Good morning, everyone. We welcome you all to the Professor Carlo Fonseka Memorial Interbatch Debate Competition. So, as you know, we are organizing this as an event celebrating the 30th anniversary of our faculty. So, I'll brief you about this competition. We are having first round competitions today and tomorrow, and then it will be in the Sinhala and the English category. Then next week we'll be moving on to the semis, and the winners of today's competition, today's debates, and one winner, one person from the best one debate team from the best loser will be going into the semis, and it will be held next week. And then we'll have the finals as a grand event, and we haven't decided the date yet, and we'll announce it as quickly as possible. So now, since this is done in the memory of Professor Carlo Fonseka, let me tell you something about him. Professor Carlo Fonseka was born in 1933, and he was educated at the St. Joseph's College, Colombo, and he was fortunate to enter the Colombo Medical Faculty. And he became the founder dean of the Faculty of Medicine, University of California, and he was a renowned physiology lecturer. He also was a former president of the Sri Lankan Medical Council, and he contributed immensely towards free education. He was not only a person who excelled in the medical field, he also was a great lyricist and a musician. So he would have really been very happy to see such an event organized in the memory of him. So now let's get back to our debate. So today, our first debate of the morning will be between the 31st batch and the 32nd batch. And they will be speaking on the topic, Sri Lankan healthcare sector preparedness for a public health crisis is satisfactory or is not satisfactory. So the proposition will be 32nd batch, and they'll be saying that Sri Lankan healthcare sector preparedness for a public health crisis is satisfactory, while the 31st batch will be opposing that by saying Sri Lankan healthcare sector preparedness for a public health crisis is not satisfactory. So these teams and the topics were selected on a fair draw, which was done in the presence of all captains. And I'll indicate about the timing. Each speaker will be given 4 minutes each to present their points, and the captains of both teams will get another round as a rebuttal round, and they'll get 5 minutes each in the rebuttal round. So now it's time for us to introduce our judges. First, we have Dr. Latika Ataude, who is a lecturer in the Department of Public Health, Faculty of Medicine, University of California. Then we have Dr. Atula Samarakon, who is a senior lecturer in politics and international studies, who is working at the Department of Social Sciences at the Open University of Sri Lanka. And then we have Dr. Chaminda Abesinghe, who is a senior lecturer at the Department of International Studies, so Faculty of Social Sciences, University of California. Now, I invite the proposition captain, Kavinjit Piris, to introduce their team members.
Thank you very much, dear moderator. So, as the second speaker of our team, we have Nilushi Karunanayaka, and as the third speaker, we have Akil Nila, and as the fourth speaker, we have Mahadi Siraj. So that's basically layout.
Thank you very much, Kavinjit. So now I invite the captain of the opposition team, Ruvisha Fernando, to introduce your team members.
Thank you, the moderator. So I'll be the captain, and I'm Ruvisha Fernando, and the second speaker will be Shihara Narampanava, and the third speaker will be Sandhini Rupasinghe, and the fourth speaker will be Dilum Pereira.
Thank you, Ruvisha. So without further ado, let's move on to witness an exciting battle between these two teams. So first, I would like to invite the captain of the proposition to build the proposition base. So coordinator, can you pin our proposition captain? Yes.
Can I know whether I'm clearly visible and audible?
Yes, you're visible clearly and you're audible. Can you see the timing card?
Not yet. I can see the timer screen. Yeah, the one
Yes, you
that
can
is
see
having the
time.
intervention, right?
Yes, that
Yeah.
is it. Okay, so you can start when the sign card turns green.
Okay, sure. Sri Lanka implemented key strategies to strengthen the emergency preparedness and response capacity of the health sector, achieving remarkable gains at policy, implementation, and field level. This is not my statement. This is the World Health Organization itself commenting on the public health crisis preparedness in Sri Lanka in their report for building resilience, emergency preparedness, and responses. With that being said, a very good morning to the honorable panel of judges, my dear opposition, the proposition colleagues, and of course the elite audience who are here with us today. So today we are speaking on the notion that the Sri Lankan health sector's preparedness for public health crisis is satisfactory. So first of all, for the ease of understanding, let's get the topic divided and clearly defined. According to the report on conceptualization and defining public health emergency and crisis preparedness, published by NCBI, which is the National Center for Biotechnological Information, preparedness for a public health crisis and emergency is designed to include a full range of prevention, mitigation, and recovery activities, and not just designed to enable the response to an event. So throughout this debate, we will be showing you how the Sri Lankan healthcare sector is adequately prepared and has achieved these specific targets in a sufficient manner, which brings us to the next most important phrase in the topic itself. Sufficient. What is sufficient? According to the Oxford Language Dictionary, sufficient is defined as fulfilling expectations or needs to acceptable, though not outstanding or perfect levels. Let me speak on the latter part and emphasize it on once again, though not outstanding or perfect. So during this debate, we are not talking about a perfectly good healthcare system that is able to cope up with each and every situation. We are talking about the Sri Lankan healthcare sector, which is in the country of the lower middle class, how it has been managing to act appropriately and to have the kind of preparedness that is required to respond to public health crisis. Just to put it into perspective, according to Global Health Security Index, Sri Lanka is categorized as a country that is more prepared. And for comparison purpose, there are some countries in our South Asian region which are upper middle class countries, but still have a lower rating. That's our country itself. So that itself proves how effective and how satisfactory the Sri Lankan system in responding to public health crisis has been over the years. And to put it out to you simply and to break it out in a proper way, how the strategic effort have been done by the Sri Lankan healthcare sector, under the Disaster Management Act number 13, which was passed in 2005, a Disaster Preparedness and Response Division was established under the Ministry of Health. And to quote, Sri Lanka has an extensive and strategic system. This is the World Health Organization itself accrediting our system for its preparedness in their report of emergency preparedness and responses in Sri Lanka. So I'll take you through on briefly what are the strategies, what exact measures have been taken by this the Disaster Preparedness and Response Division of Ministry of Health for public health crisis preparedness. They have improved structural, non-structural, functional capacity of health facilities through the Safe Hospitals Initiative, which was initiated in 2014, and improve human resources for health sector crisis management, improve stakeholder coordination for health sector crisis management, improve community participation towards health sector crisis management, and integrate results-based evaluation programs. So this is how this entire Sri Lankan system itself has been evolved properly to manage the situations of public health crisis. And I know my opposition, my dear opposition, would most like to bring up the COVID situation, and we will be discussing it throughout the debate. And my fellow colleague, the second, third, and fourth speaker will show you effectively how the Sri Lankan healthcare sector has been and is managing public health crisis in a satisfactory manner. Thank you very much.
We heard the proposition-based So now let's see what the opposition base will be. So now I invite the captain of the opposition team to present their base and arguments. Coordinator, can you spotlight the opposition first speaker?
Am I audible and visible?
Yes, you're audible and visible. Can you see this timing screen?
Yeah.
Okay. So as the screen turns green, you can start speaking.
Respected judges and the members from our opposition team and the dear audience, we are trying to convince here that the Sri Lankan healthcare sector preparedness for public health crisis is not satisfactory. And let me first outline for you what the Sri Lankan healthcare system consists of. Sri Lankan healthcare system is pluralistic and mainly adapts so largely for allopathic approach, and it also has optional healthcare systems like Ayurveda and as well as traditional healthcare systems. And the Sri Lankan healthcare system has a proper hierarchy which starts off from the top level, the Minister of Health, and it goes down to the public health inspector, and in between we have authorized personnel at the national levels, at the district levels, as well as we have medical officers of health as well. And when we are talking about the healthcare system in Sri Lanka, it is very important to talk about the private sector as well, because according to statistics, 50% of outpatient care in Sri Lanka is occurring under the private sector. And let me now draw your attention towards what a public health crisis is, but I didn't see this definition in my base of my proposition team's chapter. So what a public health crisis is, according to the NCBI website of the article on the website, a public health crisis is defined as a situation which becomes emergent when its health consequences have the potential to overwhelm the routine healthcare. So we have to highlight here that it has the potential to overwhelm the routine healthcare, and it should be prioritized. It should be prioritized over the routine healthcare needs. And so we should have a satisfactory preparedness to cope up with the public health crisis. And let me tell you what exactly is preparedness with regard to public health crisis. As my opposition team's captain said, it's exactly the preparedness is exactly not only making plans, it includes a full range of prevention, mitigation, recovery activities. And it's not just the plans, those are designed to enable responses to a prevailing situation. As well as in the same article, there was this statement that a country's preparedness for public health crisis is not a steady state. The preparedness includes, it requires continuous improvement. It includes frequent testing of plans using exercises and drills, and we have to evaluate, and we have to execute, and we have to formulate suitable and effective action plans in order for us to achieve the targets of handling the public health crisis. And let me tell you what satisfactory is. According to Cambridge Dictionary, satisfactory is good or good enough for a particular need or purpose. So what is the particular need or purpose of having a preparedness for a public health crisis? We have to minimize and reduce the damage done to people's lives, done to people's economy, and done to people's health. And in the big picture, the country's economy is also affected because of a public health crisis, and we should have satisfactory preparedness in facing a public health crisis. And when me and my team members went through many articles, we found there are some key elements for the preparedness in terms of a public health crisis, and they are health risk assessment, epidemiology functions, countermeasures and mitigation strategies, roles and responsibilities, public engagement, and laboratory functions. So what is a health risk assessment? A health risk assessment is identifying the hazard and vulnerabilities, for example, in terms of the populations who are specially at risk. So I had to desperately search for health risk assessment in Sri Lankan healthcare system, but I couldn't find any. There was not even one publication under the health risk assessment. So, my dear proposition, how can we say this is the basis of a preparedness for a public health crisis? We should at least have a health risk assessment, but we don't have that. Even the basis, we haven't prepared for that. So, how can we ever say that the Sri Lankan health sector is prepared satisfactorily for public health crisis? Over to you.
Now we're clear about the opposition and the proposition base. So let's see what the second speaker of the proposition has to elaborate and build on the topic. Zoom coordinator, can you spotlight second speaker of the proposition? Yes, you're perfectly visible, but you're muted, speaker 2.
Stop. Am I clearly visible and audible?
Yes, you are visible and audible. Can you see the screen, the timing screen?
Mm-hmm.
Okay, so when that screen turns green, you can start your speech.
Good morning. So throughout my speech, I will be bringing out examples and explaining how Sri Lanka overcame various diseases as we accounted the key elements of preparedness, same as the opposition leader pointed out. First of all, you were discussing about the health risk assessment. Obviously, in order to prevent or in order to recover from a disease, firstly, we need to identify the hazard. And I would like to point out, when considering about filaria from 1937 to 1939, when Sri Lanka reported 20 to 24% of cases which had been affected, the Sri Lankan healthcare sector identified it as a hazard. And in 1935, when the malaria outbreak was there, it was the same. And also when it comes to measles, once it was identified as a childhood killer disease, the Sri Lankan healthcare sector moved on with the countermeasures and the mitigation strategies in order to prevent and to recover from this disease. So now, moving on to the countermeasures and mitigation strategies, in 2002, the mass drug administrating campaign was established to overcome filaria, and therefore, within 4 years, we had 80% of coverage, and this affected to reduce the rate of the infections from 20 to 24% to 0.05%. And as we accounted all these, by 2016, the WHO identified and certified Sri Lanka to be a country which had eliminated lymphatic filaria from 2016 onwards. And also moving on to measles and rubella, Sri Lanka identified it as a health hazard. They identified the childhood population to be vulnerable. So therefore, during the childhood immunization program itself, the measles and rubella vaccination was done. We did a 95% of coverage, and therefore, by 2018, Sri Lanka achieved the rubella control and measles elimination targets ahead of what was given by the WHO, which was the year 2020. And now moving on to the next, which is the roles and responsibility. In 1947, the anti-filaria campaign was established. This was not something that the healthcare sector did it by its own. It was a strong political commitment. The parasitological surveillances, the health sector, the health education programs were conducted to reduce the stigma associated with this risk, the disease. And also the public health inspectors, the midwives, the social volunteers, the mobilization campaigns, all these were associated together. And also, it's same when it comes to malaria, the endoresidural spraying and the regular survey of the adult and larvae mosquitoes in the endemic districts were conducted. So therefore, Sri Lanka identified and we accounted the key element of roles and responsibilities in order to clearly define, assign and test responsibilities in all sectors and all individuals in order to prevent and to recover from this disease, as well as mitigate it. And now moving on to the public engagement, the most typical example we could take is the leprosy. So when discussing about leprosy, back then Sri Lanka, when we were severely affected by leprosy, we came up with the social marketing strategies which increased the self-reporting cases from 9% increased between 10 years. And also, due to this reason, by 150%, we increased the detection, and that helped us to overcome leprosy by 1995. And also, moving on to the laboratory functions, back to measles and rubella. Today, Sri Lanka is free from measles and rubella, yet we know that there is a risk. So therefore, Sri Lanka is yet maintaining the capacity to detect the readiness and respond to the measles virus. And also, most importantly, as a country with a low resource setting, Sri Lanka is yet free of the indigenous malaria and the malaria cases, and the WHO clearly states this is because of the case detection through active acid blood filming. So even the Sri Lankan healthcare sector had accounted all these key elements, and therefore we can clearly state that we are prepared in a satisfactory manner in order to overcome a public health crisis. Thank you very much.
As the proposition second speaker build up arguments, let's see what the opposition second speaker has to say. Zoom coordinator, can you spotlight the second speaker of the opposition? Okay, can you speak up so we can check your audibility?
Hello, am I visible and audible?
Yes, you're visible and audible. Can I know whether you can see the screen, the timing screen? The main screen is saying inter-batch debate competition.
Not really. Is the timer on right now?
No, it's not. It's a blue screen. You should be able to see it.
Oh. I see the screen with the
okay, then
no, I see the screen with the moderator and the screen with the logo.
Yeah, that's it. That's what you should see.
Okay.
Can you see the inter-batch debate competition screen?
Yes.
Okay. So now you can start when the screen turns into green color.
Thank you to my proposition speaker. I would like to further point out some of the key elements in the preparedness of emergency situations in our Sri Lankan healthcare sector that are not satisfactory, relating to some of the points you mentioned yourself. The epidemiologic functions, you said that the captain said that there were some laws that were put forward in 2005 or so. However, when you talk about having a prepared system to overcome a healthcare crisis, this is something that needs to be consistent. This is something that needs to be generalized, and something that we need to be prepared for a future crisis at any given moment, so that the nation is prepared in all hierarchical systems of its healthcare center. However, even when we were dealing with the most recent health crisis that we are facing even right now, there was no proper preparation. Nobody knew a common guideline to follow, and everybody was figuring out how to deal with the situation when we were faced with it. And until we are faced with it, there is no generalized guideline that people are aware of, that the staff is aware of to follow. There is vaccinations being issued by PHI in some regions, by the army officials in other regions. Nobody is sure which role they play. There is no common communication, and there is no common adherence to a certain path that they are aware of. And we can see that dealing with this situation, even after we were met with the initial outbreak of COVID, hasn't really made us any more prepared for the future. When we faced with new waves of it, and when we faced with new variants of it, we were still dealing with these problems as it came, although we had familiarized and could have been more prepared from our initial exposure to this situation. If we check the official statistics from the Sri Lankan Health Promotion Bureau itself, we can see that even today we have an average of 4,268 daily COVID cases, and this is still at 76% of our peak values. And we still have a fatality rate in Sri Lanka that's above the global average of 2.06%. And our recovery rate is also still below the global average of 89.57%. So these are not values that should be presented by a country that the health sector is prepared to deal with the crisis situation now. If we check the countermeasures and mitigation strategies, including the isolation, the quarantine, and distribution of strategies and the workforce and the equipment into different healthcare sectors, this is also not up to standard. There's a lack of ICU beds and ventilators. There's a scarcity of blood in blood banks. There's a scarcity of PPE needed when conducting PCR or dealing with COVID suspected patients. And even when you get certain facilities, there is a lack of the staff that's properly trained, and the staff is overworked due to the lack of a proper responsibility distribution among the individuals. And we can see in the study current on critical care status in intensive care in Sri Lanka, it was stated that 60% of the ICU beds of our country are congested into the teaching hospitals, and the periphery are still lacking. And even this, we have a ratio of 8 to 10 ICU beds per 1,000 hospital beds, while the international norm is 10 to 40 ICU beds per hospital bed. So we are still below the acceptable level there too. So yes, it's still not acceptable. And even when it comes to the staffing, a lot of the staffing in these facilities had 3 to 6 week training in intensive care, and that too in a selected region. And there was no further training done unless they had done it voluntarily. And the nurses in charge were specifically trained only in 29% of these ICU care units. And we could see that even the US Disease Control and Prevention had advised their audiences not to travel to Sri Lanka due to the high increased rates of COVID, and the CDC marking a value of level 4 high risk to our country. So again, if we were properly prepared to handle this situation, this type of situation of instability would not still be there. These values would not still be presented. So we cannot say that this is an acceptable level, because we are still dealing with the problems at hand, which is a below average progress being shown. So I still stand on how it's clearly visible through the numbers that the healthcare sector of Sri Lanka is not sufficiently prepared to handle a healthcare crisis. And even if we face with another in the coming years, we would not be better prepared, because the consistency is lacked. And it's not only dealing with the situation at hand, but also being prepared to deal with it in the future. Thank you.
So as the opposition build up some arguments like that as well, let's see what the third speaker of the proposition has to say. Zoom coordinator, can you spotlight?
Yeah, am I audible and visible?
Yes, you're audible and visible. Can you see the screen?
Oh yeah, I can see the screen.
You can start when the screen turns into green color.
It's unfortunate that the opposition, in their quest to prove the disregardness of Sri Lanka's health preparedness, has completely confused themselves. So let me take some time and enlighten our esteemed opposition. Let us start by talking about disease surveillance, which is one of the essential aspects of the prevention and protection phase of health preparedness. Surveillance is essential to make accurate forecasts and identify major outbreaks before they even appear, thereby taking the required steps to curtail them. Sri Lanka has an excellent passive surveillance mechanism in place, which covers 28 communicable diseases, all with the ability to report unusual outbreaks. In addition, Sri Lanka employs a sentinel site surveillance for diseases such as dengue, measles, rubella, etc., all of which are coordinated from the highest level by the epidemiological unit to the lowest grassroots levels by the PHIs. In addition to that, all I have to say is the World Health Organization states, and I quote word for word, Sri Lanka has a strong, highly proficient health system and a surveillance system that covers the most important diseases. What more do you want? In addition, if you move on to immunization, which is once again an essential facet of the prevention and protection phase of health preparedness, it enables healthcare sectors to keep the deadly infectious diseases at bay. Sri Lanka initiated its expanded program on immunization in 1978 under the guidance of the World Health Organization. Since then, it has grown exponentially, and as of now, Sri Lanka has received a perfect score of 5 out of 5 by the World Health Organization for both vaccine coverage and national vaccine access and delivery. Not just that, the Global Health Security Index ranks Sri Lanka 1 out of 195 countries, right there at the top of the world when it comes to immunization. For comparative purposes, our neighbors, India is ranked at 101, Bangladesh at 87, Pakistan is at 151. We are there at the top of the world. It's not just satisfactory, it's extraordinary. Moving on to mental health care services, actually that Mental health is an essential phase of the recovery phase of health preparedness. People, especially in these times which we are living, people are depressed due to the COVID-19 pandemic. Therefore, efficient mechanisms need to be in position to enable people to return back to their normal lives. Mental health care plays a crucial role, and the World Health Organization says, and I once again quote, Sri Lanka serves as a model for mental health care due to its transformation of mental health care in the past 2 decades. Now, the opposition came out saying that the most recent pandemic has been mismanaged by Sri Lanka. Do they not realize that Sri Lanka implemented a sequence of control strategies even before COVID was declared as a pandemic, which included limiting human mobility, extensive contact tracing, and strict lockdown measures? In addition to that, Sri Lanka bolstered its major hospitals and laboratory facilities, and the GHS once again rates Sri Lanka's lab facilities far above the global average. In addition to that, the epidemiology workforce of Sri Lanka is once again rated above the global average, and all of these are further bolstered in response to the COVID-19 pandemic. And Sri Lanka's health infrastructure has 3 levels of readiness which can easily combat major pandemics, which was able to successfully curtail the spread of 2 waves. Unfortunately, third wave was a failure. Yes, we accept that. But what is the reason? Let me simply put it this way. A country with such a great track record of immunization faltered at COVID-19. Why? I'm going to quote from Amnesty International, direct word for word. It appears that those with economic or political privileges was able to obtain the doses, even though they did not belong to the risk categories. Further, Amnesty International goes on to state that on the 19th of May 2021, the Secretary of the Ministry of Health issued an order threatening disciplinary action against anyone in the healthcare sector for speaking in the media, citing criticizing health policies as the reason. It doesn't matter how well prepared the healthcare sector is if there is no multi-sectoral collaborative efforts. If the healthcare sector has been undermined by higher authorities, none of that preparation is going to be of any use. Furthermore, the opposition came out saying that they could not find any statistics about Sri Lanka's health risk assessment. I could not understand, since the opposition seems to be confused in their quest. The GHS, the Global Health Security Index, clearly states that Sri Lanka's ability to detect and report conditions are far above global average. In addition to that, we have so many surveillance mechanisms in place, which will be spoken later on. Thank you.
Many arguments are brought up and broken as well. Let's see what the third speaker of the opposition has to say. Zoom coordinator.
Can you
Yes.
see me and hear me?
Yes, you're perfectly visible and audible. Can you see the blue color screen?
Yes.
Yes. Okay. So you can start your speech when the screen turns into green color.
Thank you, my dear opponent. I'd like to mention one of my opponents talked about the Disaster Management Act, but did you know that our first responders or EMPs are only trained to handle natural disasters? But what about other public health crises like another pandemic or something even more extreme like a bioterrorist attack? With the way the world is going, is it that much of a courage to imagine something like that could happen? Do you think we'll be able to handle something like this? But we see today there's so much conflict between political leaders and healthcare officials. I mean, this conflict, why is it there? The nation doesn't have a clear plan as to how to manage this public health crisis. We don't know the measures that we are aiming for, and the methods are ambiguous, and the policies are uncertain. We don't have a clear picture of the whole plan. And one of my opponents talked about implementing control strategies. It's not enough. They should be constantly evaluated and monitored. That doesn't happen in our country, and we don't have a database evidence-based data used in making our plans to manage our risk. And countermeasure mitigation strategies should be constantly monitored and evaluated. Otherwise, this preparedness is like an ongoing process to actually manage the crisis. And one of my opponents mentioned about malaria and filaria outbreaks. They don't actually cannot be considered as public health crisis according to their captain's definition, because they didn't overwhelm the system. We're not here talking about how our country is good at managing communicable diseases. We're talking about how we're facing public health crises, and the current day is a good example that we're not managing it properly. And what about public engagement? It's one of the key elements of preparedness against a public health crisis. It's one of the health sector's responsibility is to prepare, inform our community, but we don't see that happening right now. And now our opponents consistently talked about how good our healthcare sector is. We're not saying it's not good. We're not just prepared for something that would overwhelm our system. And one of the examples is right now in MOH offices, their PHIs, their duties are disrupted right now. Their routine work is disrupted because our system is overwhelmed by COVID-19 cases. Even now, we see a lot of treatment facilities set around COVID-19 treatment facilities that doesn't have proper staffing or equipment. I mean, that's such a waste of resources that should be handled accordingly. These things should be planned before we face a crisis, but we don't see that happening. One of the biggest problems in our healthcare system is that the workforce is not adequate at all levels, not just in the lowest levels. And I talked about crisis management teams earlier as well. We don't get the EMTs training here is in a really low standard compared to developed countries, and also the urban and rural disparity. The standard of services is really problematic, especially in the face of a crisis like this. It just shows that we're not prepared to face something like this, and our community, it's not prepared. We can't even overcome the myths that are surrounding our system. And if we talk about our research culture is so poor. This is not even based on focusing on this system development. That kind of research could actually help us face a public health crisis, but we don't have a system that concentrates on system development. And we talked about EMTs not being properly. We also don't have ambulances. Did you know for the hospital beds for 1,000 people only increased a very small amount during the past 6 years? That can't be considered as progress. And I'd like to say once again that we're not prepared for crisis handling in this country. Thank you.
So as the third speaker of the opposition says like that, let's see what the fourth speaker of the proposition has to say.
Am I audible and visible?
Yes, you are audible and visible. Can you see the blue color screen?
The timer? Yes, I can see it.
Okay, so when the screen turns into green color, you can start your speech.
My previous opponent was speaking about that healthcare access is poor in Sri Lanka. Well, the World Health Organization states that access to healthcare is an important indicator in assessing health systems' capacity for crisis management. I too agree. And the Sri Lankan sector has given us that access. According to the Global Health System Index, Sri Lanka has a healthcare access 10% better than the world's average score. This can be further supported by the Sri Lanka's annual health statistics that shows that the sector has an average bed per 1,000 of 3.9 in each RDHS division, a clear-cut indication that Sri Lanka health sector was, is, and will be prepared to face a public health crisis. And let me support my arguments with even more studies, which I noticed that many of my opponents are failing to do so. Now, one of my opponents have come and said that the healthcare sector doesn't have has enough resources such as ICU bed, ventilators, oxygen supplies to care for patients. My dear opponents, the COVID-19 is a crisis of unprecedented scale. A satisfactory preparation for the crisis can be carried out single-handedly by the health sector. But in cases of prolonged crisis, like in Sri Lanka, where we had to face a new variant, the preparation, just like my colleague said, needs to be a multi-sectorial collaborative effort. Look at Spain and Italy, countries with excellent infrastructure and health preparedness, yet crippled under COVID-19. It is insatiable of you to ignore the Sri Lankan healthcare sector's current satisfactory preparedness, expecting them to be perfect when the percent of GDP invested on the sector is approximately 3.76%, which according to the World Bank is well below the health expenditure of a country of 9.87. My opponents came here telling that we were not prepared for the COVID crisis. My dear opponents, let me get you again clear. Let me redefine what my captain said. Preparedness does not only refer to being prepared to ensure that a crisis never happens, but it also means to be prepared to control and mitigate a crisis if it does happen. And in the case of Sri Lankan health sector, it has been well prepared to face the crisis of COVID-19. According to the Bogan magazine, Sri Lanka's COVID-19 response came quickly after the first reports of the virus in China in December 2019. To achieve a low death rate and effective containment of the virus, the Ministry of Health swiftly identified the risks and the need to be heightened communication between the public, quickly mobilizing pandemic readiness plan. And by the time the World Health Organization officially declared COVID-19 a public emergency in March, Sri Lanka had already established prevention techniques due to the satisfactory preparedness of its health sector. My opponents came bringing up saying the health sector doesn't have inadequate facilities for studying COVID-19 virus. Well, the Global Health Index gives Sri Lanka's healthcare sector a score 30% higher than global average when it comes to laboratory system. According to the Sri Lankan Preparedness and Response Plan, once again, another important statistic that this already well-established system has been further strengthened to ease the burden of MRI by making use of 3 hospital labs and 1 university lab. This, coupled with the high GGS index score on Sri Lanka's healthcare sector's capacity to test and approve new medical countermeasures, proves once again that our healthcare sector is prepared to face a public health crisis. My opponents were telling about problems coming when they're dealing with the COVID vaccine program, etc., etc. So my dear opponent, you told that we didn't have any scientific-based plans. Well, the Sri Lanka health sector had prepared a scientific-based vaccination program to mitigate and control the pandemic. The National Advisory Committee on Communicable Diseases had listed out 4 high-risk groups when it comes to this vaccination program. However, the program was not followed as planned, and mishaps arose due to the interference of other parties and not the health sector. We at the health sector of Sri Lanka had always been prepared satisfactorily for this pandemic, and we will always do so in other pandemics to come. My opponents brought up saying that we don't have any proper communication. Well, my dear opponents, according to an article published in NCBI, due to the help of the Health Promotion Bureau of Sri Lanka, we were able to have proper risk communication within the country. Take a look at the preparedness and response plan one more. The roles of the Bureau has been clearly laid out about communicating with affected communities, public communication, and strengthening of the risk communication system, which you're saying that our satisfactory prepared country health sector does not have. My dear opponents and ladies and gentlemen, we are not here to debate on whether the healthcare sector is perfect. We are here to propose that in an event of a public health crisis, that the Sri Lankan healthcare sector is satisfactorily prepared to prevent, mitigate, and recover from the crisis. And over to you.
Okay, now let's see how can the opposition 4th speaker can respond to that speech. Zoom coordinator, can you pin? Okay. So you're clearly visible. Can you turn off your turn? Yeah, you're muted.
Okay, so am I clearly audible and visible?
Yes, you're clearly audible and visible. Can you see the timing cards screen?
Yes,
yes, you can start your. Yes, the blue color screen.
Yes. Okay, I can see it.
So you can start your speech when the color turns into green.
Okay. From the very beginning, I would like to turn my attention towards the opposing team. And ladies and gentlemen, turning towards the opposing captain, he states that the definition of sufficient, he takes it from the Oxford Dictionary. However, from the very beginning, I would like to point out that when we speak about this public health crisis, sufficiency in a context of public health sector, we simply cannot take a definition from an English dictionary. We have to take to appropriate resources within the context. And if we take a look at such examples, if we look at such articles within identified publications, such as the research paper called Conceptualizing and Defining Public Health Emergency Preparedness by Christopher Nelson and his team, which was published in the American Journal of Public Health, we can clearly see that being the layman's definition is not enough. That is to say, we have to be able to have public health preparedness means healthcare systems having communities, individuals to prevent, protect against, and quickly respond to and recover disasters of whose scale, timing, and unpredictability threaten to overwhelm the routine capabilities. And satisfactory is not merely saying we may not be perfect, but we are satisfactory. That is not what is satisfactory. There are objective definitions set by governing authorities that determine what satisfactory means. We cannot just say there can be problems, but we may not be perfect, but we are satisfactory, because even to be satisfactory, you have to meet minimum requirements that are set by the government authority. And the captain also said that we are one of the best countries when it comes to Asia, when it comes to South Asia, as an upper middle class country. However, again, this is not a question of subjectiveness. We could be the best country in the world and still be unprepared, because we do not meet the proper requirements set by the government, or maybe the governing authority like the WHO, or maybe any other set by many other professionals. Again, he said that there were plans implemented in 2014, to which I would like to point out, according to the article that I cited before, it has been stated that preparedness means coordinated and continuous planning and implementation. That means we have to have coordinated planning from one sector of healthcare to another sector of healthcare. We have to have continuous planning. We have to have coordinated planning. We have to have coordinated implementation. And if we are still running on policies set in 2014 amidst the COVID virus, then you can see that we have not progressed one bit from 2014. Turning to the second speaker, she said that filaria, malaria, measles, and such diseases have been managed, and that it takes time to prepare. I agree. However, I would like to point out that reduction is not preparedness. Reduction does not necessarily mean preparedness. It does take time to adapt. True. However, have we met the objective requirements? She also said that leprosy has been, the self-reporting rates of leprosy went high within 10 years. However, this is not part of the healthcare sector. This is done by the general public. That is not improvement in the part of the healthcare sector. Again, she said that, the topic we're talking about is healthcare sector. Turning to the third speaker, he said that immunization for deadly diseases has went up. However, immunization is done to babies in order to prevent a future faraway health crisis. However, a health crisis is something that threatens to overwhelm the capabilities. Immunization is done to prevent a health crisis maybe about after 30 years. So that is not something that would maybe do in the near future. Again, the mental health, the treatment of mental health, which is done by, and yes, programs are done during COVID. However, these are not done by the public health sector, but rather by the armed forces and maybe by various artists. He also said about outstanding lab technologies. However, just having India has outstanding lab technologies. However, these are very limited and they cannot test against overwhelming routine capabilities. That is what we are saying. And he also said about how Sri Lanka is higher on a global index. However, this is about overall health sector and not specifically about public health crisis. Thank you.
Now it's the last chance for the opposition to make sure their arguments are stable. So now I invite the opposition captain for her rebuttal round. Yes. We lost your video. You're muted.
Am I audible and visible?
Yes, you're audible and visible. Can you see the screen? Timing screen?
I'm seeing the screen.
Okay, so you can start your speech when the screen turns green color.
My dear proposition, we have clearly said that Sri Lanka is not adequately prepared and Sri Lanka's preparedness is not satisfactory to face another public health crisis. And you have been constantly saying we have outstanding remarks from WHO. But did you ever find any remark on the preparedness for public health crisis? We didn't agree. We didn't say that we don't have a good healthcare system. We do have. That's why we say we can get more prepared for a public health crisis more than any other country. But does WHO have any article telling that we are satisfactory as a country? We are satisfactory prepared for a public health crisis. I'm going to ask you that. And you were talking about the lower middle class countries. And now, are you witnessing Myanmar? The GDP of Myanmar is very lower compared to us. The GDP of Myanmar is about $130, and the GDP of us is $4,100. So what? That's a big difference. But Myanmar is due to a strict lockdown, and the cases of deaths, the cases of COVID-19 patients are going to get minimized day by day. But we have increased number of deaths, and we have ranked number 1 in terms of the deaths related to COVID-19. For 478 cases, we report 10,864 deaths. So is that satisfactory? And you told that in the first wave we prevented it. Yeah, we prevented it. We accept that. But we could have, after the first wave, we could have been more prepared for consecutive waves. Because we were not satisfactorily prepared, we are experiencing this bitter experience now with the deaths due to COVID getting skyrocketed. So were we prepared? And even now, are we prepared for another crisis? We are only having actions on this when we get the problem. But in my base, I clearly said that for a public health crisis preparedness, we need to include a full range of prevention, mitigation, as well as recovery activities. And also, I told you that we have to keep a track of how the plans are going, and if they are not working, we have to constantly attend to them, and we have to formulate and execute better and corrected action plans. So the second speaker was constantly talking about 1970s, 1980s, 2005, 2004. So we got experience from those cases. We somehow managed to survive those conditions. But were we prepared after those things? Did we ever learn a lesson? And did we ever try to get prepared for another public health crisis? We weren't prepared. The preparedness was not satisfactory at all, because 2012, the number of deaths per 1,000 people was 6.8, but in 2018 it was only 6.9. For a whole period of 6 years, we only improved the number of deaths per 1,000 people only by 0.1. So how can we say that we were anyway prepared for a public health crisis? And also the fourth speaker was telling about the economy. So how can we say that the economy does not depend on the health of people? Sri Lankan policymakers make very short-sighted decisions. They are only talking about the current economy, but they are not aware, or they pretend to not be aware that in the long run, after about 3 to 4 years, we will be having a higher economic crisis because of the bad health of people. And one of the major factors which decide the economic development in the country, is the good health of people. So why are we that short-sighted? And you were talking about the vaccination program, and even your fourth speaker agreed with us that the vaccination program were misused. Yeah, it was misused. So how can we say that the preparedness we had was satisfactory? Because when we implemented that plan, we did not adhere to action to formulate and execute more a corrected action plan. The policymakers, they themselves also misuse the system. And we are also saying that the preparedness for public health crisis does not solely depend on policymakers. They actually depend on the policymakers, the medical professionals, and also the public. So we are referring to all these parties in terms of getting prepared for public health crisis. But all the parties are not prepared, and even the policymakers, they have a higher responsibility in getting the public even prepared, in informing the public and making the public aware of the possible public health crisis outbreaks. But they are hiding the correct data. The data is not given. The political influencers in making the having a good satisfactory preparedness for a public health crisis is deteriorated because of the political influences. So are we prepared for a public health crisis in 1 month or in 2 months or in 1 year? Are we prepared? I request answers from my captain from the proposition. Thank you.
As the opposition captain gives a finish like that, let's see how can the proposition captain finish off the debate in a high note. Captain, can you see the screen?
Yeah, can you hear me?
Yes, I can hear you. You're perfectly visible.
Okay, great.
Okay, you can start when the screen turns into green color.
Honorable panel of judges, my dear opposition and the proposition. I must say, initially I was thinking of starting from the first speaker and going on to the last speaker, but our opposition leader's rebuttal is indeed hilarious. So let me start on what she said. She asked, on what statistics are we presenting this data? We have presented each and every point that we presented, each and every argument that we had was perfectly backed up with a statistic. That is something that I can assure, and I can send you the link that we have provided with all the source documents of our arguments. And you asked, where is a statement from the WHO or any other authorized institution saying that the Sri Lankan health sector is prepared? I'd like to ask this question, my dear leader from the opposition. Wasn't you paying attention to what I said at the beginning itself? The opening statement itself was saying the Sri Lankan health sector's preparedness for a public health crisis made by the committee and the report from the WHO on resilience and emergency preparedness in Sri Lankan context. So that itself, I believe you have the answer for what you were looking for. And the second, and there was this interesting point that was brought about as well. You were saying that we said the economy isn't dependent on how the health sector acts. It wasn't us, my dear leader. It was your fourth speaker. Thank you very much for providing the base for my rebuttal, because your fourth speaker was himself saying that the economy is independent. Our fourth speaker was in contrast saying that Sri Lanka, being a lower middle class country, has the economic issue, and the health sector itself depends on how the economy as well as the general activity of the country depends. So let me come back from the first speaker's initial speech. You said that the health sector did not have any routine healthcare activity. So this is how, as I said in my opening speech itself, the disaster management and prevention department under the Ministry of Health itself functions in the process of providing and making those necessary plans. In my opening speech itself, I pointed out 6 key strategies how the health response division acts. And also, you asked whether risk assessment has been done, and you said you seem to lack the ability to research, to do the necessary research to point out the arguments. According to the Global Health Security Index, and the Sentinel surveillance mechanism is completely carried out in Sri Lanka, and it is a well above average score in Sri Lankan context. So definitely, my dear friend, I have found something that you were having difficulty, and you should be thankful to me for that. And moving on to the second speaker, he said that though it was passed in 2005, it does not mean it is currently prepared. Let me ask you this simple question. There's a law that has been established in 2005, and for the current date, does it mean it doesn't apply or it isn't valid? Just because the system was established in 2005, it has been active ever since. And even in the COVID-19 pandemic, and you said like how the Sri Lankan health sector can act on the policies that were created in 2005. This is how we act, my dear friend. Sri Lankan healthcare system prepared a specific response plan for COVID-19. As my earlier speakers pointed out, according to the Borgen magazine, which is one of the major media outlets in global health issues as well as global political issues, they said that by the time WHO established this situation as a global health pandemic and a global health crisis, Sri Lanka had already made the measures and the policies in place. This is how effective our public health crisis preparedness system is. This is how efficient the system is. So absolutely no point in saying that. And you talk about the lack of communication. Of course, communication is one of the major aspects in public health crisis preparedness. And I'd like to ask you, my dear friends, wasn't the 247 line, which is for COVID patients, circulated in your batch as well? This is what communication means. This is what creating the communication between the health sector and the general public means. This is how the communication has been established. And that is how the Sri Lankan healthcare sector has been effective and has been up to a satisfactory level in doing so. Next, let me move on to the third speaker. 2 speakers are done, and the third speaker. She said that the Sri Lankan disaster management and emergency unit under the Department of Health only prepares for these natural disasters. My dear friend, really sorry to see this. To enlighten you, only in 2014, 56 rehearsals were done for public health crisis response. That is how effective our system is. From 2014 onwards, it hasn't gone down, it has gone up indeed. The preparation, the initial action, and everything, each and every step in the process has been done over and over again. And there was this interesting statement saying that malaria and filaria weren't actually public health crisis. My dear opposition, let me point out to you, there were 80,000 deaths during this process. So how can you say that this is not a public health crisis if it is not what is so? So with that being said, since the time limits me, the arguments are stable, and my opposition has tried to build a huge base without actually a proper base, and now it has totally collapsed to the ground. And our points are stable. The health sector of Sri Lanka has done a satisfactory preparedness for public health crisis. Thank you very much.
So I think we all witnessed a great battle between these two teams.